Welcome back to How I Med. It's the COVID-19 mini-series. So today, it's our second episode, and we're here with Ricky. He is one of the managers in the ultrasound department in one of the New York City hospitals on the east side. So we just wanted to know how it is on his side as the managerial position, as well as in the ultrasound, because right now, Mike and I are both exposed in the ICU, so it is very, we're both very curious as to how it is on his side of the story. So go ahead.
Hey everybody. So I would say that I'm sure we're all going through the same challenges from one hospital to the next. You know, being a manager, once being a technologist a very short time ago, I realized that when push comes to shove in situations like this, our positions no longer matter. We have to take off our suits and get those scrubs back on and get our hands dirty, because we can never forget that we are a part of the front lines, no matter what. You know, nurses can't do their jobs without us. Doctors can't do their jobs without us, and vice versa. You know, we're just a giant team. And I have seen COVID patients from very mild cases to the most extreme cases. You know, patients expiring as they're coming in. It's pretty much a big domino effect, you know, and it's really sad. And the biggest thing, that the misconception that I've seen in society is that the age group that COVID affects, people of our age, are kind of blinded because they feel that they're invincible, as we all do at this age. But the problem is that COVID doesn't discriminate. That's not biased. It goes against all of us. I've seen already people in their 20s to 30s on ECMO, full support, perfectly healthy prior to being, you know, diagnosed with COVID. Their body just can't handle it, and, you know, they end up expiring because, you know, as we all know, you can only be on ECMO for so long, right? I've been in the room with ECMO patients, and, you know, ultrasound, a lot of people think that ultrasound is just scanning babies and it's just taking pictures. But, you know, ultrasound is huge here, especially with the diagnostic tool to see the lungs. It's actually starting to be a more common order, where instead of bringing the patients over to CT, which CTs, as you know, it takes more time to bring the patient to the CT, get them done, and then have to clean the room. You know, only a certain amount of CTs could be done a day. They've been proven to do ultrasounds on the lungs, and it's amazing how you could actually see the difference in the lungs with ultrasound alone. It really will speed up the process with diagnosing, you know, a patient with a more advanced level of COVID, opposed to somebody that's not as bad. I'm just more intrigued to find out with you guys about your positions as far as supplies, as far as how you guys go about your day with the PPEs, because with us, it's literally like searching needle in the haystack for an N95. Even if we ask certain nurses for N95s, sometimes we're told no because of how limited they are. And I've used an N95 for up to a week and a half.
Wow.
Yeah, because, you know, I'm a normal size N95.
Right.
A majority of the N95s that are around are small. So, you know, I would carry a paper bag with me, and after I'm done, I would make sure the strings are out of it, fold it tight, and put it back in the bag, and then throw it in my, you know, my office desk, and then bring it with me until I go to the next floor where somebody will supply it with me if we don't have any. You know, it's scary. It is. Yeah.
So what I've experienced this week, I know the past couple of weeks, the PPEs were really, we were really, really, really short. It looks like now it's getting a little bit better
Mm-hmm.
to the fact that at least you get a new N95, at least one per day, compared to saving one for however long you don't know. The N95 that I had when I went to SICU in my hospital, we were able to exchange it if it got super soiled, because we were actually in a COVID patient. I had an orientee with me. We were in the COVID patient room for at least even 2 hours at one time, because we had to change the CVVH of the patient, and those patients with COVID, they are like clotting and bleeding at the same time. It's been like a consistent trend. So, and now everyone's in like renal failure. So, if those who are like really sick. So we were in the room for about like 2 hours, which is scary because like it increases your exposure, increases your viral load per time that you're in the room. So with that being said, with the PPEs, we were able to get a new one because it was just so soiled, because we were just in there just breathing in that patient's room, and it was kind of scary to know like literally the doors close, you know this patient's positive, you see like the sputum coming out of the mouth, and you have to like suction. So you want to make sure that your PPE is really protecting you, because it's like right in front of your face. Yeah. So we do have only one N95 per day, but if it does get super soiled, then they'll give you one. It doesn't look like they were too strict when I went to float there. But they also have like a pretty good supply of surgical masks to go over your head. To go over the N95 to protect it, so you don't have to keep on switching it just in case. I did hear from someone that it would be nice to like put a gauze inside your N95, so it doesn't get so protected from some moist. Yeah, but I haven't really did that because I don't really feel comfortable kind of opening up the mask and putting it inside. Mm-hmm. I don't know how, like, I can wash my hands, but I don't know exactly how clean it wasn't something I was going to do. But yeah, it was just, so in regards to the PPEs, that was that. The bonnets we have a lot of, so I don't think that was like an issue. The gloves are fine, the gowns are fine, but what I noticed, a lot of the nurses and the doctors that I was floating to on those floors weren't really wearing masks, even when we were rounding. So to me, it was more just, I just didn't like it as much, just because I just feel like healthcare professionals are the ones that are carrying it. We don't know we have it, but it's kind of presumed that you have it because you have so much exposure. So I just feel like as healthcare professionals, like I even see people, if they're like eating inside the lounge or if they're eating here, they automatically take it out with their friends, but you're actually really at high risk getting it from your coworker. Mm-hmm. So I just don't even take it out at all. So even when we're around, if some people are just rounding and talking, sometimes you're only like 3 feet away from each other before we can't really hear each other, like we're screaming. But yeah, some people weren't really wearing masks, and I don't know if it's the fact that all of us are kind of not wearing masks at the time, that people were just spreading it, and some nurses are out sick right now. But starting yesterday, everyone is required to wear a surgical mask, so you actually get it when you're walking to the hospital security. Yeah. Right. I think it just has started yesterday, right?
Yeah, I got it on. It started
or the 26th. I'm not exactly sure. One of those days, I forgot. But I worked yesterday. That's why I know. So I don't know if it started the day before. But that I saw was better. I think it was because we have more supply of surgical masks now. So I don't really feel like the huge amount of like stress and anxiety with surgical masks. But with the N95s, we are allowed to get one. I looked at my email from yesterday. So if you want to have one, you can get one from your charge nurse. They usually hold it. At least it is in our unit. And if you want one for sure, and then I think you could get another surgical mask for you to wear just at home, or at least like with your family. Yeah. But yeah, that's how it is with the PPEs. But in regards to actually taking care of the COVID patients, it is kind of scary because, it's sad because patients are really dying without loved ones. Because if you think about it, the loved ones, if they're positive, they live with the people, their family who's positive, so they're quarantined at home. So they can't even come inside at all because everyone is positive. So you have to either Zoom or FaceTime all the patients, and most of the time they're like sedated. I haven't really witnessed a withdrawal on a COVID patient. I just hear that like a lot of patients are actively dying a lot. But I just know that they're dying without anyone at the bedside. Their lactate is like really high. They're they're bleeding, clotting. They have really bad coronary artery disease. It's just like it's kind of crazy how the trend of all these patients that you see are really similar for the elderly, especially like this, who are like 70 and older, I guess. But for people who are younger, my friend from another hospital, she's a nurse practitioner. She told my sister, who told me, that a lot of the younger patients who are about like my age, 20 to 30 years old, they don't know they have it, but then they start getting maybe very mild symptoms like chills, or maybe like a low grade fever, so they go to the ED. And you listen to them, they sound clear, they're not having any shortness of breath. But then when you check their SpO2, their oxygen, it's 92%. Like they've been hypoxic for 92. Like
So much stress on the
95 and greater is ideal. 100 is ideal, but they're like hypoxic 92 because they don't have really any symptoms. And then when you do the X-ray is crap, and that's when you have to immediately intubate. And with that, a lot of the younger people go into like myocarditis, like their heart gets inflamed, and that's when you see the most severe cases.
Mm-hmm.
This is what I was told, and this is what I've kind of been hearing around in the hospital too from like reliable people. But this is, I don't know if I don't think there's any real research. I think this is what has been observed since the past couple of days, I guess. But yeah, so I guess it's just nerve-wracking because these COVID patients, like, even though yes, they're COVID, they are still people too. So it is really sad. Like,
that's the main message that I really send to my staff. And you're right. They're playing touch and go with this because it seems like there are new symptoms coming up as like this virus is evolving in a weird way.
I agree.
And it was kind of funny how you were, I'm gonna touch base on a couple of things you said. So yes, I wear a fluid shield mask over my N95 at all times to protect it and also to protect my eyes.
Right.
And the nurses there at the hospital, what they did is they actually have extended leads. I mean, not leads, the IV lines.
Yeah.
And the lines are actually like traveling across. It's so like the way that they makeshifted this thing is like the lines are running all the way across the room outside the door. So the nurse never really has to go in unless there's an issue.
Right.
You're right. I do see that with a lot of doctors. Doctors aren't wearing proper PPEs a lot of times. And, they're just wearing regular surgical masks. And sometimes they don't even wear the yellow isolation gowns. They think by just running in the room real quick, they're safe. But, that's really not. As soon as you go in there, you're contaminated. And, I think any of us that have been working through this can pretty much say the same thing. I haven't seen my family in probably like 2 to 3 weeks now.
Yeah.
The most I've gotten, as close as I've gotten, is I've went to like the front yard and like spoke to them through the window.
Yeah.
Because, it's sad. I mean, you want to be near your family at the same time, that if you do come close to your family, this virus lives on your skin. This virus could live on anything. You leave the hospital, you get into your car, you leave the hospital, you put on your jacket. Guess what? Now that is contaminated, and it's proven for up to days on some of these objects, so you can't take any chance, especially with a lot of our parents are in that age,
exactly,
where God forbid, I don't think any of us would ever be able to forgive ourselves if we got one of our parents sick.
I think I know that I heard a story of one of the nurses. The mom is in the hospital, and because the nurse works as a nurse in the hospital, most likely she's the one that gave it to the mom. So I could just imagine what she's going through, because I would be hurting if anything was to happen, and it was because of me.
Of course, it's the worst, So Mike, like, what are you with COVID patients at all, or have you been?
So I've been working with non-COVID patients. Mostly my unit is the last resort for non-COVIDs. As of this past weekend, our unit has 2 separate sections. One section now is going to be converted to a COVID unit. So the patients that are not COVID are being transferred to a main side, and we will see. I think that after this weekend, we will start taking COVID patients. So I'm really interested to see how they're going to divide the nurses who will take care of the COVID patients versus not taking care of them.
Mm-hmm.
I get a little worried. It's just because now we're going to have a huge population we have a small population that doesn't have COVID. And I think it's important to make sure that, consistent nurses are taking care of those patients. So it's not like transferred, because we have constant mix up of nurses. I think it increases the chances of the non-COVID patients, but we'll see what
cross-contamination.
Yeah, for sure.
Of course. I mean,
Yeah.
I gotta tell you, as far as workflow goes, and I'm going around my hospital, it seems like, I mean, I know there aren't COVID patients. I mean, there are COVID patients that aren't COVID, but it's almost like everybody's COVID. It's really crazy. I mean, if you really look at it, I mean, if not everybody's COVID yet, it's just spreading like wildfire, and there's no matter how careful you are. So I have now 5 employees that are out with COVID symptoms. 3 of them have been tested positive for COVID. The one thing that I don't really appreciate with hospitals, the way that they're going about it, is I don't feel like they're protecting the healthcare employees enough, because I feel like all of us should be tested for COVID, just as you were saying, because instead we get symptoms, and what they do is they just tell us, go home and come back in 14 days.
Yeah, but honestly, I just feel like, I would love to know if I have symptoms.
Yeah.
And if I'm positive, but I think for those who are having active symptoms, I think they should get tested, because they're already out of work. You might as well test them. I think the whole reason why they don't want to test is because they don't want the nurses to be out, but they're already out, so might as well.
Yeah.
If you're tested positive, you could have those antibodies, and then you could donate it or something. It's just, I don't understand that. What?
Even non-employees, right? I just know, just from seeing with my own eyes, people that go to the ED with COVID symptoms, they have mild fever, the usual mild fever, diarrhea, all those symptoms. Instead of testing them for COVID, if they are not sick enough to be admitted, they give them and they tell them to go home. And I feel like that kind of messes with the numbers that society is being given on how many positive cases there are. You're kind of like,
New York has half of it, but we're turning down a lot of people to get tested, so it's probably double of what it really is. Of course,
yeah, and as much
Queens
as
is the most.
Scare people, we should. The reality is, you should probably add another 10 to 15,000 people on top of that number. Yeah, it's really scary. Yeah, so we're pretty much losing employees by the day, because it starts out as like, oh, I didn't feel that right on Tuesday, but then by Thursday they have a mild grade fever and they're coughing and their body's killing them. They can't get out of bed, and that's when you're just like, all right, you're done.
And you can't even blame them. They're sick,
Yeah, we're just lucky that a lot of hospitals have this special pay, I think, for employees that do get sick, instead of
right, covered.
Yeah, we are fortunate with that kind of stuff, but this is definitely a time where employees, as not even healthcare professionals, I don't want to even just say within hospitals, ambulances down to essential workers, even people that work in supermarkets, as much as we're afraid to get sick, this is a time in life where we are needed most. And just like, not to compare it, but when there's war, they run for the fight to protect us, right? So in this aspect, it's kind of like we have to wake up every morning, we have to go in there acting like this is a fight that we have to beat. And if we're not there, then this thing is going to just continue to take over.
Mm-hmm.
I mean,
It
that's
is kind of scary though when you go into work and then the patients who come in for admissions have to be intubated right away. And with each intubation, it's like a pretty scary thing, you know.
yeah.
For a lot of anesthesiologists, I don't know, and CRNAs doing the intubations, I feel like the most at highest risk because they're doing all the intubations, and
Mhm.
of course, like everyone who works with COVID patients in general. But I don't know if I feel like those who are literally doing the intubation just because they're emergent and it's just like you don't know what's going to be spraying in your face once they intubate. I just feel like that's kind of scary.
Yeah, no, that is really, I was thinking about that too. You know, all the bodily fluids, everything that goes into even intubating, it's just anything can
Yeah.
happen. And you don't really have time to put on your PPE and be like, oh, wait a second, while this person is
Yeah.
coping. It's like you
Yeah.
kind of like got to do your job and just pray for the best.
That's what happened to some nurses too. Like you come in and the trach when it came off the ventilator, you don't have time. The patient's like desatting.
Yeah.
So I mean, I heard there was this one nurse that like couldn't even have time to put in the proper mask and just went in with a surgical mask. And obviously, with the trach, I mean, with it disconnected from the vent, there's like stuff spraying. So that was obviously an exposure, and that's something that you obviously had to tell. She's out of work for now, negative for like. Thank God, but it's more of like that's like something that people don't realize, like for a patient, like that's what we do.
Yeah.
But like you have to also protect yourself. So
Yeah, I think this time is for like we have to be like like what they say in the airlines. You first have to put the shield on you before you put it on.
yeah,
So we really
yeah,
have to take the initiative to prepare ourselves before we take care of the patient, because if we're
yeah,
out, we're gonna be out for 2 weeks. That's gonna make the unit shorter, and then there's gonna be so many effects to that. Your short unit, they're gonna be in emergencies. Other staff members are gonna be in emergencies, and we just all really need to take the time to just put our PPE, even if a patient. I mean, as long as they're not coding, that's one thing. But if it's not super urgent, really just take the time to put your PPE on the correct way.
yeah.
I was amazed today because I went to ShopRite and 80% of the people did not have masks on. People were looking at me like I was crazy.
Oh my God, all I see is infection.
Yeah, the employees had no mask. Everyone's like not, people are all by the vegetable areas and they're just
touching everything.
And I was like, I can't believe it. I was so shocked.
It's just like so funny if you don't work in the healthcare field, like, or in the hospital in general. Like, if I see a group of people, I'm like, oh my God, that's such a huge infection right there. I can't even imagine how everyone went out to restaurants before this time. I feel like it's been the longest, like, almost 2 to 3 weeks that I used to go to concerts and used to go to club bars, and now I can't even imagine all that going on now. Like, ew.
Saving a lot of money though, right?
I know. Yes, you're right. Well, actually, I moved.
Look
so
at Mike. Mike's like, oh my God. Mike, you hear Mike and saving. He's like, oh yeah.
Well, actually, it was like someone's losing a lot of money with the stocks. No.
Oh yeah.
Eventually, I come up.
I'm surprised you didn't start getting into that crypto again.
I have everything right now.
Oh yeah,
Oh, God.
you got your hands in everything. Yeah, it's really funny you say that. So I posted something, and I'll share it now just because it was really amazing. I went to Chip, New York, that cookie place over off the 59th Street Bridge. I forgot what street it was on. It started with a C though. And I was done with work. It was like a 16-hour day. And I get to the door because I saw somebody post something on it. So, you get that craving.
Yeah.
I was like, at work, I'm getting
Damn it. Now I have it. Yeah.
Exactly. So I got there and the girl comes up to the front. She was like, I'm sorry, we don't allow people in. You have to download the mobile app and I'll sell them to you like that.
Oh, cool.
I was like, okay, fine. So I'm just so tired from such a long day. I'm waiting for it to load up. And then the owner,
You really wanted it.
Yeah, I was kind of like, is this really worth it as it's loading? And then the owner or the manager, this guy, he comes up, he's like, I was in my scrubs, we don't get throwaway scrubs or anything. I'm sure you guys don't either, right?
No, unfortunately not.
So he was just like, hey, listen, we have s'mores and funfetti. Like, which ones do you want? And I was like, I guess just give me a little bit of both. And he's like, all right, listen, I'll just get it ready for you. And I was like, okay. So he put in the box, came up. He's like, I just want to thank you for everything you're doing. He's like, I'm sure that, you know, you've seen it all. And, you know, I just want you to stay safe. Take these cookies around me, you know, get home safe. I was like,
that's
wow.
so nice.
That was like really nice of him. It really like it made my hair stand. I was like, wow, like this was such a long day like that to see such like a amazing humane gesture like that. It was really, it was nice. So I went home and I stuffed my face. I made sure they didn't go to work. No gym. I'm like, all right, I'm just gonna get fat and small for the summer. This is 2020, my year.
The thing that I see a lot of people doing now is on a daily or weekly basis, I'm getting money from people on Venmo, and they're just Venmo me like $5, and it's for like coffee, and I'm like, oh my God, this is such a nice gesture. I mean, give or take, we do work 13, 14, 15 hours a days, you know, 15 hours. So it's really nice that giving these little gestures, you know, $5 really goes a long way for us because that coffee gives us the energy.
Oh yeah, definitely. You know, we actually we have nursing schedules now. Because we're
nice. Flex?
Not really even flex. So we're just reducing the exposure for workers and management. So I do 3-day weeks, Wednesday, Thursday, Friday. It's supposed to be 8 a.m. to 9 p.m. But I always like to get in before 7 because I want to see how the midnight shift is doing to see, you know,
I
want to make sure that my staff, that nothing happened. If anything, that I could address it.
That's good. Yeah.
Yeah. So I do like 7 to 9, 6:30 to 9, and you know, I want to give it to you guys because everybody in the healthcare field that isn't a nurse, that doesn't have that schedule, they say, oh, I wish I had those hours. I wish I had those hours because I have so much time off. But really, it takes me a couple days just to really recover from working that kind of schedule, especially under such a high stress environment. If you're working in the CCU, the surgical, the CTICU, I mean, I can't imagine being with one or even more, 2 patients that are critically, you know, ill and having to monitor these people from 7 a.m. to 7 p.m. multiple days in a row. I mean, it's not even, I feel like it's more mental exhaustion than it is physical exhaustion. And, you know, I give you guys credit because I really always wanted to have that shift. But at the same time, those 3 days feels as long as my 5-day schedule.
Yeah. Honestly, I used to work 3 days in a row. I don't do that anymore just because it's so exhausting. I usually work like 2 and then 1 day off and then on again, just because I feel like if I'm working 3 days straight in a row, I'm like, my body is really tired. Like mentally, like I don't feel like I got enough sleep because I need to really reset my body. But it's really long. I mean, those days off, like I feel like I really deserve those days off to like recuperate. But it is a really long schedule, so that was really nice of you to notice that.
You know, I mean, people always use that mentality where it's like, you know, the grass is greener on the other side, but it's definitely there's always give and takes with everything, no matter what. I mean, I would love to do 3-day weeks if it was split, if I could do like a Monday, Thursday, Friday. I mean, I feel like that would be nicer. But like, you know, Tuesday I'm gonna go in even though it's not my day off, even though it's my day off, just because, not for nothing, if that's my reason to get out of the house, going into work, even though it's risky there, I can't stay inside for 4 days in a row.
Yeah.
It really, I'm going stir crazy here.
Yeah, I know. So you know, I know, I hear that too.
There's only so many things you can watch.
I have to go.
Okay.
I'm sorry.
No, I thought this was a great back and forth. I really did. I really enjoyed this, and I'm glad that, you know, I'm glad it's all out there though.
We will do another video with you for sure in the future. Hopefully after this whole COVID is
post-COVID
mini series. How are we getting back to life?
Yeah. We'll be skinnier.
We're gonna be out Zooming, not even Zooming anymore. We'll be together at the bar.
Exactly.
Or at my new apartment. Anyway.
With Coronas.
There's gonna be a lot of those.
I like that. So thank you, Ricky. I really appreciate it. We really appreciate it. And we really,
Stay safe.
thank you. You too.
All right. See you guys later.
Bye.
Bye.